The pandemic of COVID-19 was a global event unlike any other, demanding unprecedented responses and generating intense debate. The challenge was not just medical, but complex, encompassing initial scientific uncertainty, geopolitical tensions, massive economic pressures, and significant difficulties in data integrity and public communication. Our analysis today aims to conduct a balanced, forensic review, examining the discrepancies and underlying dynamics that fueled public distrust. The story begins with the origin of the SARS-CoV-2. The scientific consensus largely favored a natural zoonotic spillover, the virus crossing from animals to humans, a well-documented mechanism. However, the initial context was marred by a profound deficit of transparency from the affected regions, which created fertile ground for other hypotheses. One persistent question focused on the proximity of the Wuhan Institute of Virology, WIV, and the documented high-risk gain-of-function research conducted there. While the vast majority of genetic studies indicate a natural origin, the existence of such high-risk research, coupled with initial secrecy, represented a communication failure that fueled speculation. This opacity, rather than proof of a definite leak, damaged public confidence in the subsequent international investigations. As the virus spread, governments implemented non-pharmaceutical interventions like lockdowns and mandates intended to protect public health. While these measures were crucial in the early phase to slow the spread and prevent the collapse of healthcare systems, their long-term efficacy and the broader societal costs became subject to intense scientific and economic debate. Studies suggested that the observed efficacy was often due to the voluntary behavioral changes of citizens. This debate suggests that the efficacy of top-down policies was sometimes overestimated compared to individual commitment. In parallel, the economic and social cost was enormous. Significant impacts on employment and notable global economic damage are estimated. Public discourse often created a false dichotomy, preventing an honest discussion on the necessary balance between health protection and civil liberties and economic well-being. The bedrock of public health is accurate data. Yet the pandemic revealed profound challenges in data collection and reporting. Provisional death counts were inherently delayed, subject to change, and complicated by inconsistencies in classifying cause of death across jurisdictions. A more complete measure, excess mortality, the difference between observed and expected deaths, revealed that the total human impact was broader than reported, due to cascading effects like the neglect of chronic diseases. Compounding this, the challenge of communicating complex and evolving data, such as cases of revised death counts by agencies like the CDC, created a fog of war that eroded public trust in official statistics. The development of COVID-19 vaccines was a stunning scientific triumph, but even this success was obscured by misinformation regarding safety, efficacy, and financial transparency. Scientific studies consistently demonstrated the high safety and efficacy of vaccines, particularly in preventing severe forms of the disease. Although rare side effects, such as myocarditis, were recorded, it was clinically proven that the risk of myocarditis following SARS-CoV-2 infection is significantly higher than the risk from the vaccine. Nevertheless, these rare occurrences were exploited by misinformation campaigns to fuel hesitancy. A legitimate element of criticism concerns financial transparency. Pharmaceutical companies reported very high profits. Although research was supported by massive public funding, the lack of full disclosure of purchasing contracts and significant redactions in public versions raised questions about whether the goal of a global public good was compromised by private commercial interests. The final piece of this complex puzzle is the infodemic, an overload of information, some of which was unverified. Trust was undermined by inconsistencies in official communication. Early statements from experts and organizations were sometimes incomplete or erroneous due to the rapid evolution of understanding of the virus. This communication breakdown transformed a health crisis into an information war. Misinformation was not merely fabrication, but often a reconfiguration of existing information and, most critically, it was exacerbated by the politicization of health issues, transforming scientific consensus into an ideological battleground. The reality of COVID-19 was a mosaic of medical, scientific, economic, and political challenges. Its complexity was not managed by a conspiracy, but by a perfect storm of unprecedented uncertainty, communication failures, and divergent interests. The greatest lesson is the need to demand transparency and to promote a governance model that balances the protection of public health with the safeguarding of civil liberties and social well-being.